Welcome to this edition of Phenomenal Health. I'm Dr. Jeff Hawkins. Today we're going to be discussing why chiropractic has become so popular with one of Florida's leading experts. If you're suffering with any kind of pain and you're looking for a natural way to treat it, then you better stay tuned. You're really going to love this show. Don't go away. We'll be right back.
Welcome to Phenomenal Health. Phenomenal Health is informative and exciting. Phenomenal Health interviews leading experts in all areas in healthcare, so you become a much more informed consumer. Now, here is your host, Dr. Jeff Hawkins.
Welcome back. I'm Dr. Jeff Hawkins, and you're watching Phenomenal Health. I'm very fortunate to have with me today Dr. Sabrina Morgan, who is a doctor of chiropractic. Dr. Morgan received her undergraduate training at the University of Florida and graduated in 1997 from Los Angeles College of Chiropractic, one of the best colleges in the country, and is a board-certified doctor of chiropractic. Dr. Morgan has been featured 3 times in the publication On Call, the Journal of the Palm Beach County Medical Society, on the topics of pregnancy and chiropractic medicine, the role of chiropractic in treating headaches and spinal injuries, and whiplash. She's also appeared on the TV show A Woman's Place, discussing pediatric chiropractic and mind-body medicine. Dr. Morgan is also certified in the Webster in utero technique. Dr. Morgan has been practicing in the Lake Worth area for 7 years, and she's here today to discuss why chiropractic has become so popular. Dr. Morgan, welcome to the show.
Thank you. I'm excited to be here today.
I'm really glad you're here. I'm glad you took some time out of your busy schedule to come on and explain to the people of your area exactly what chiropractic is all about and why it's become so popular. So the first question I have for you is, why don't you tell people watching why you decided to set up your practice in the Lake Worth area?
Well, Dr. Hawkins, I found a office condominium I was able to purchase in the Western Lake Worth area, and it's a great area with a lot of families coming to the area with a lot of growth.
Okay, now why don't you tell people why you decided to become a doctor of chiropractic?
Well, my sister was in a car accident, and she was experiencing terrible headaches and sciatica, which is numbness down the legs.
Okay.
And after about 6 weeks of chiropractic care, it had helped her significantly where drugs and other types of therapy had not helped her.
Okay, that's interesting because I interview a lot of chiropractors across the country, and almost without fail, the reason why they decided to become a chiropractor is because of some kind of personal experience they've had, where medicine failed, chiropractic helped, and now that's why they decided to become a chiropractor. So it's pretty interesting. Now, the next question is in my research preparing for doing the show, I've come to realize that chiropractic has become extremely popular in the last 15, 20 years, or maybe before it wasn't. So why do you think chiropractic is becoming so popular now?
Well, chiropractic is extremely popular, frankly, because it works. It's very safe and effective, and again, a lot of times people are sick and tired of taking medications and being recommended for surgery that may or may not help them with minimal results.
Okay, so now for people that are watching who've never been to a chiropractor and maybe don't know anything about it, why don't you explain to us exactly what chiropractic is?
Oh, sure. Allow me to utilize or demonstrate on the spine.
You just happen to have a spine,
yes.
Right?
And basically what happens is the brain, which sits on top of the occiput, the brain stem, the spinal cord passes through the entire spinal column.
Okay.
And each of these white parts here are the vertebral bodies, or different bones in the spine.
Okay.
And in between them are the disc spaces that you see here. These are the jelly material that acts as a shock absorber.
Okay.
Now in this part here where you see the yellow lines, these are the nerves that exit the spinal cord. And basically what happens is each nerve controls not just whether we have pain, but also any type of organ or system in the body, depending where that nerve is exiting from. So for example, if a person has, these bones can actually slip out of alignment, and if a person has a misalignment, let's say in the neck, it could actually put pressure on the nerves that come out of the neck that go up to the head and cause headaches. And that can happen between any of the nerves that exit the spine. The spines are movable in each of the motions.
Okay, so basically then if the bone gets misaligned and pinches on one of those nerves anywhere down the spine, it can cause some kind of pain or malfunction in the body.
Exactly.
Okay, so now as a chiropractor, when you find out that the bones are misaligned, like you just mentioned, how do you readjust those or realign those vertebrae?
Well, that's a great question. What we do is basically analyze where the misalignments are by palpation, which is simply checking the spine to see which joint is out of alignment.
Okay.
And basically, using our hands, we gently realign the spine using the transverse process, which is this part of the vertebra here, which gently realigns the spine.
Okay, and then by doing that, does that take the pressure off the nerve?
Absolutely. It takes the pressure off the nerve, and not only a lot of times reduces pain, but also helps the body to heal itself.
Okay, so now when you do that with your hand, when you realign the spine back into place like that, what does it feel like when you do that as a chiropractor?
Oh, it feels great. A lot of times people will say they experience like kind of a natural high and endorphin release that helps them feel a lot better immediately.
Okay. Now I know in your office you really focus on correcting a person's spine and their problem, not just eliminating their symptoms, which is typically what medications do. It just covers up the symptoms. So explain to us a little bit about your philosophy on that and how you go about really focusing on correcting the problem, not just getting somebody out of pain.
Sure. What we do is by analyzing the spine, we can see where the misalignments are, and basically we check from the nerves that come out of that area. So, for example, again, if someone comes in with lower back pain, we can check the lower back area to see if there's misalignments in that area, and by gently realigning that area, that will help to take the pressure off the nerve and allow the body to heal itself.
Okay. Now, what services do you provide in your office?
We offer, obviously, chiropractic and also physical therapy, massage therapy. We offer laser light therapy, which is also very effective in helping a multitude of conditions. And we also do diagnostic services, x-rays, ultrasound, nerve testing, and MRIs.
Okay, so it kind of sounds like a one-stop shop. You really have a lot of different services under one roof, so people don't have to go all over the place for different things. Okay, so let's explain to us some more about this laser light therapy. How does that work and what does it do?
The laser light therapy is a non-invasive, non-surgical approach to helping people feel better, and it's very effective for a multitude of conditions, specifically carpal tunnel syndrome, sciatica, neuritis, plantar fasciitis, frozen shoulder, and even neuropathy and fibromyalgia. And it works by helping the body to reprogram itself and allow its cells to heal.
Okay, so how does that work then? Is this a light and you kind of hold it on the different area? Or?
Exactly. It's a red infrared laser light, and it works by introducing a healing frequency into the tissues that allows the body to start healing itself.
Okay, I know that's become really popular, this laser treatment in the last couple of years. A lot of different offices are using that, and I know it's really phenomenal with some of these different conditions.
Yes.
So I know, do you want to give people a gift right now? I know there are people watching tonight that you want to give them a gift for watching, so what is that right now?
Sure. Anyone watching tonight, if they call in our office at the number below, they're able to come in for a complimentary consultation worth a $300 value.
Okay, and what does that consultation include?
A consultation includes, basically we do a consultation, ask them, their health history, they fill out some forms, and we do a thorough exam and a detailed analysis to see if we could help them.
Okay, well, that's great. On behalf of the people watching, I want to just thank you for doing that because that's really generous. I think that's a really nice way for people to come in at no charge to just really find out if you can help them or not.
Exactly.
Okay, now, Doctor, we have to take our first break right now, and as we go to the break, we're going to hear from some testimonials from some patients who are getting great results using chiropractic. When we come back, we'll continue talking about this, okay?
Great.
Okay, now, if you're suffering with any type of pain and you're looking for a natural way to correct it without using medications or surgery, then you need to call Dr. Morgan's office and make an appointment to see her. As a doctor of chiropractic, Dr. Morgan has special training at treating most types of pain in your body. When we come back from our first break, we'll talk about what kinds of pain can be caused by misaligned vertebrae in your spine, and we'll continue to talk about why chiropractic has become so popular. We'll be right back.
If I were to talk to someone who was asked if they should go to a chiropractor or not, I'd say that I've had positive results associated with going in and seeing a chiropractor. I've had a variety of issues from a lower back problem in my younger years to just even the everyday kinks that happen in your neck area or in your mid-back, just having that ability not to be able to turn your head. And every time I've gone in to see a chiropractor, I come in not feeling good and I leave feeling better. So I know that there's a solution there. And if someone were to ask me if they should take a look at going in to see a chiropractor, I would encourage it and give them my thumbs up and encourage them to do that because I figured if it works for me, it could work for them as well.